A lot of people assume that taking vitamins is always a good thing, the more the better. That is what we have been told for decades. You care about your health, you read the labels, you do the right things. So every morning, you line up your supplements on the counter and you take them together, all at once, because that is what responsible people do. But here is the truth: most doctors do not take the time to sit down and explain to you. Some of those vitamins are working against each other at this very moment. Not slowly, not theoretically. Right now, inside your body, certain combinations are doing the opposite of what you intend. And one specific combination, one that millions of people over 60 take together every single morning, has been directly linked to strokes, internal bleeding, and in some cases, organ failure. What makes this especially dangerous is that the harm is invisible. You feel fine. You think you are being healthy. And then one day, you are not. A study published in the Journal of the American Medical Association followed over 38,000 adults over the age of 60 who regularly took multiple supplements. The researchers found that nearly 60% were taking at least one combination known to cause serious adverse interactions. Nearly 60%. That means more than half the people watching this right now may have a dangerous combination sitting on their counter at home. So here's the question I hear almost every week in my clinic. Doctor, I take my vitamins every day. Why do I still feel exhausted, foggy, and unwell? The answer is inside this video. And if you are over 60, this message could save your life. My name is Dr. Patricia Holt. I am an internal medicine physician with over 28 years specializing in supplement pharmacology and senior health. What I am going to share with you today is not opinion. It is not fear. It is documented science that most people never hear until something goes wrong. We are going to count down from number 5 to number 1. And I am going to warn you now. By the time we reach number 1, you will likely recognize something you do every morning, and you will want to stop immediately. Before we begin, I want to plant something in your mind. The number 1 most dangerous combination on this list does not just reduce the effectiveness of your vitamins. It actively creates a toxic reaction inside your liver, one that builds silently over months. Doctors call it competitive hepatic saturation. We will get to exactly what that means and what to do about it. But first, let us start at number 5. Here is something important to understand before we go any further. Your body after age 60 is not the same as your body at 40. The way your digestive system absorbs nutrients changes. The efficiency of your liver and kidneys in processing supplements declines, and the enzyme pathways that govern how vitamins are metabolized become narrower. Think of it like a highway that used to have 8 lanes. After 60, it has narrowed to 3. When you send 8 lanes of traffic through 3 lanes at once, you do not get better absorption. You get a collision. That collision is what happens inside your body when you combine the wrong vitamins. And that is exactly what we are going to talk about right now. Number 5, calcium and iron. These two are the most commonly combined supplements on the planet, and they are one of the most problematic. Most people over 60 take calcium for bone density. Many also take iron, especially women with a history of anemia or anyone who feels chronically fatigued. They take them together in the morning because it feels efficient. Get it all done at once. But here is what is happening inside your body when you do that. Calcium and iron compete for the exact same absorption channel in your small intestine. That channel is called the divalent metal transporter, DMT1. When calcium occupies that transporter, iron cannot get through. When they are taken together, calcium reduces iron absorption by 49 to 62%, according to research published in the American Journal of Clinical Nutrition, which studied 211 adults over the age of 55 over a 16-week period. Think of it like 2 people trying to walk through a revolving door at exactly the same time. One of them is going to get stuck. The door was only built for one. When calcium takes the door, iron stays outside, and eventually it accumulates in the stomach lining instead of entering the bloodstream. I treated a 67-year-old woman named Dorothy who came to me completely baffled. She had been taking both supplements for 3 years on the advice of her previous doctor. Her iron levels were critically low despite consistent supplementation. She was exhausted, pale, short of breath, Her ferritin, which is the protein that stores iron in your body, was almost undetectable. When we tested her calcium levels, they were adequate. Her calcium had been absorbing perfectly for 3 years while quietly blocking nearly all of her iron. Now, how many of you take calcium and iron together in the morning? Write the actual number of years you have been doing this in the comments below. That number matters. The good news is this. The fix is simple and immediate. Take your calcium in the morning with breakfast. Take your iron in the early afternoon, at least 4 hours later, on an empty stomach or with vitamin C, which actually helps iron absorb. 2 separate windows. That is all it takes. Your iron levels will stabilize within 8 to 12 weeks. Now, as important as that was, number 4 is even more common, and its consequences are considerably more severe. Number 4. Vitamin E and blood thinners, including vitamin K. This one surprises almost everyone, because vitamin E has such a healthy reputation. Heart protective, anti-inflammatory, and antioxidant, and all of that is true. But there is a critical interaction that most supplement labels will never warn you about. Millions of adults over 60 take vitamin E for heart health and take vitamin K either as a supplement or as part of a multivitamin. Others are on prescription blood thinners like warfarin, and some take all 3 at once. The danger here is not subtle. Vitamin E at high doses, anything above 400 IU per day, acts as a natural anticoagulant. That means it slows blood clotting. Now, vitamin K does the opposite. It promotes clotting. Your body needs both of these functions, but they work as opposing forces. When you take them together in high amounts, you do not achieve balance. You trigger erratic coagulation signals, which means your blood does not know whether to clot or not. That unpredictability is what causes the danger. A study in the New England Journal of Medicine analyzed 4,800 adults over 60 taking combined vitamin E and anticoagulant therapy over a 5-year period. The study found a 38% increased risk of hemorrhagic stroke, which is bleeding in the brain, among participants taking more than 400 IU of vitamin E alongside blood-thinning agents compared to those who took neither or only one. Think of this like 2 hands on a steering wheel, one trying to turn left and one trying to turn right at exactly the same time. The car does not go straight, it swerves unpredictably. That is what your blood clotting cascade does when it receives conflicting chemical signals. I once cared for a 72-year-old retired teacher named Gerald, who was taking a 1,000 IU vitamin E capsule every morning, along with a vitamin K supplement his wife had read about for bone health. He had no idea they interacted. One afternoon, he developed a sudden, severe headache and his speech began to slur. By the time the ambulance arrived, imaging confirmed a small but dangerous bleed in his cerebral cortex. He recovered, but his speech required months of therapy. He told me later, "I thought I was doing everything right." If you are over 65 and currently on any blood-thinning medication, or taking both vitamin E and vitamin K, please stop and speak to your doctor today before your next dose. The good news is this. If you want vitamin E for heart protection, keep the dose at or below 200 IU per day, which is a safe range with minimal anticoagulant effect. And if you are on prescribed blood thinners, discuss every supplement with your prescribing physician before adding anything new. The interaction is manageable, but only when your doctor knows what you are taking. Now, the next one is the one that shocks my patients most, because number 3 involves a vitamin almost everyone over 60 takes every single day. Number 3, vitamin D and magnesium depletion. If you take vitamin D, and statistics suggest that 79% of adults over 60 in the United States do, then this section is critical. Vitamin D is one of the most important nutrients for people over 60. Bone density, immune function, mood regulation, cardiovascular health. The research supporting it is overwhelming. But here is what the bottle does not tell you. Vitamin D cannot be activated without magnesium. And more importantly, the process of activating vitamin D burns through your magnesium reserves at a rate most people never account for. Here is the mechanism. Vitamin D in the form you take it, either D2 or D3, is biologically inert. Your body cannot use it in that form. It has to be converted by specific enzymes in your liver and kidneys into the active hormonal form called calcitriol. Those enzymes are magnesium dependent. Every conversion uses magnesium as fuel. So the more vitamin D you take, the more magnesium your body burns through. If you are not supplementing magnesium at the same time, your magnesium levels silently drop. Research published in the Journal of the American Osteopathic Association analyzed 800 adults over 60 taking high-dose vitamin D supplementation of 2,000 IU or more per day. The researchers found that 71% of participants had significantly depleted magnesium levels after 12 weeks, even though they had begun the study with normal ranges. 71%. Think of vitamin D as a car and magnesium as the fuel. You can have the most powerful car in the world, but without fuel, it does not move. And when the fuel tank runs dry, the engine starts to stall. In your body, a stalled engine looks like muscle cramps, heart palpitations, insomnia, anxiety, and high blood pressure, all of which are classic signs of magnesium deficiency. One of my patients, a 64-year-old man named Robert, came to me with an alarming set of symptoms: heart palpitations at night, severe leg cramps, anxiety that came out of nowhere. He had been taking 5,000 IU of vitamin D daily for 6 months, following advice he had found online, with no magnesium supplementation whatsoever. His blood levels showed severely low magnesium and paradoxically low vitamin D activity despite massive supplementation. His body had the vitamin D but could not use it, and his magnesium was nearly gone. How many of you are currently taking vitamin D without magnesium? Write D only in the comments right now. I want to know how many people are in this position. The good news is this: adding magnesium glycinate or magnesium threonate, two forms that absorb well and are gentle on the stomach, at a dose of 200 to 400 milligrams per day, alongside your vitamin D will not only restore your magnesium levels, but will dramatically improve the effectiveness of your vitamin D. Most people notice better sleep within 2 weeks and reduced muscle cramping within 4. It is a simple addition that changes everything. But now we come to number 2. And this one is dangerous not because of what 2 vitamins do to each other. It is dangerous because of what 1 vitamin does to your prescription medication. Number 2. Vitamin K2 and anticoagulant medications. Let me be direct. This is the combination that sends people to the emergency room, and it is completely preventable. Vitamin K2 has become enormously popular in the last decade, and for good reason. Research shows it helps direct calcium into bones rather than into arterial walls, reducing arterial calcification. It is genuinely beneficial for older adults. But there is a hard line that cannot be crossed. Warfarin, also sold as Coumadin, works by blocking vitamin K's role in activating clotting factors in your blood. That is the entire mechanism of the drug. If you add vitamin K2 into your system, you are directly counteracting the drug's ability to do its job. Your blood becomes more prone to clotting, and for someone who is on warfarin because they have a history of blood clots, atrial fibrillation, or a mechanical heart valve, that is not a theoretical risk. That is a life-threatening reversal of their treatment. A study published in Thrombosis and Hemostasis followed 620 warfarin patients over 60 who added vitamin K2 supplementation without adjusting their medication dose. Within 6 weeks, 44% of those patients had INR levels outside the therapeutic range. INR, or International Normalized Ratio, is the measurement doctors use to monitor blood thinning effectiveness. Being outside that range in either direction means you are either at risk of clotting or at risk of uncontrolled bleeding. Think of warfarin and vitamin K2 as 2 people arm wrestling inside your bloodstream. The warfarin is trying to keep the blood thin. The vitamin K2 is pushing it back toward clotting. And when they wrestle, your INR swings violently. Your doctor set your dose based on the assumption that vitamin K2 was not in the equation. I will never forget a patient named Evelyn, 74 years old, who had been on warfarin for years following a deep vein thrombosis, a blood clot in her leg. She started K2 after seeing a television advertisement about bone and artery health. She told no one. Within 2 months, she developed a clot that traveled to her lung, a pulmonary embolism. She was hospitalized for 11 days. The cause was traced directly to the K2 disrupting her warfarin levels. She survived, but it was a terrifying and entirely preventable ordeal. If you are over 60 and on any blood-thinning medication, warfarin, rivaroxaban, apixaban, or any other anticoagulant, do not take vitamin K2 without your doctor's direct supervision and specific dose adjustment. This is not negotiable. The good news is this: your doctor can absolutely manage vitamin K2 alongside anticoagulants, but only if they know you are taking it. The process involves more frequent INR monitoring and a gradual, supervised dose adjustment. Many patients do successfully take both, but the decision must happen with a physician, not in a supplement aisle. We are now at number 1, the combination I mentioned at the very beginning of this video, the one that creates a toxic reaction inside your liver over months. I want you to prepare yourself for this, because this is the one that surprises my patients most. Number 1, high-dose vitamin A and high-dose vitamin D. Together. This is the one that builds in silence. No sudden symptoms, no dramatic warning, just slow, invisible, accumulating damage to the liver and the cardiovascular system until one day something breaks. Here is why. Vitamin A and vitamin D are both fat-soluble vitamins. That distinction is critical. Unlike water-soluble vitamins like B12 or vitamin C, which your body flushes out in urine, fat-soluble vitamins are stored. They accumulate in your liver and fatty tissues over weeks and months. Your liver uses the same enzyme family, the cytochrome P450 enzymes, to process both of them. And here is the problem. Those enzymes have a finite capacity. They can only do so much at once. When you take high doses of both vitamin A and vitamin D together, you create what researchers call competitive hepatic saturation. Competitive hepatic saturation means the liver's processing enzymes are overwhelmed and saturated by both vitamins simultaneously. Neither can be properly metabolized. Both begin to accumulate at toxic levels. Vitamin A toxicity, called hypervitaminosis A, damages the liver. It causes bone fragility, hair loss, severe headaches, and in advanced cases, liver failure. Vitamin D toxicity, called hypervitaminosis D, causes hypercalcemia, which is dangerously elevated calcium in the blood. Hypercalcemia can cause kidney damage, heart arrhythmias, and calcification of soft tissue, including the heart lining. A study published in the Annals of Internal Medicine followed 1,400 adults over 60 who were self-supplementing with both vitamin A at doses above 5,000 IU and vitamin D at doses above 2,000 IU for more than 12 months. The study found that 34% showed elevated liver enzymes indicating liver stress, 22% showed elevated serum calcium levels, and 8% had progressed to early-stage kidney involvement. And crucially, the majority of these participants reported feeling no different than before. Think of your liver's enzyme system as a narrow drainage pipe. When you pour one fat-soluble vitamin through it, it drains efficiently. When you pour two at once, in large volumes, the pipe backs up. The vitamins have nowhere to go. They pool, they stagnate. They begin to damage the walls of the pipe, and the pipe is your liver. I treated a 69-year-old retired engineer named Harold, who came to me with abnormal liver function tests discovered during a routine physical. He had been taking a high-potency multivitamin containing 8,000 IU of vitamin A and separately taking a 5,000 IU vitamin D supplement every day for nearly 2 years. He felt fine. He was proud of his supplement regimen. He had no idea that his liver was under sustained biochemical stress. His liver enzymes were 3 times the normal upper limit. His calcium was creeping upward. We stopped both supplements immediately and introduced lower, separated doses under monitoring. His liver values normalized over 4 months, but 2 years of daily damage had accumulated because nobody had told him this was dangerous. If you are over 60 and taking any supplement that contains vitamin A, including cod liver oil, certain multivitamins, and any supplement labeled retinol or retinol palmitate, check the dose. Then, check your vitamin D dose. If you are taking more than 3,000 IU of vitamin A and more than 2,000 IU of vitamin D simultaneously, you are in the danger zone. The good news is this: the solution does not mean giving up either vitamin. Both are genuinely important for older adults. The answer is dose management and timing separation. Keep vitamin A below 3,000 IU per day if you are supplementing directly. For most people over 60, getting vitamin A through diet, from foods like sweet potatoes, leafy greens, and eggs, is far safer than supplements because dietary vitamin A is converted from beta-carotene in controlled amounts. For vitamin D, 1,000 to 2,000 IU daily is the sweet spot for most adults over 60. And have your levels tested. A 25-hydroxy-vitamin D blood test tells your doctor exactly where you are and whether you even need to supplement at all. Get the test before choosing your dose. Do not guess with fat-soluble vitamins. Now, before I give you the rapid summary, I want to share 5 essential rules. These rules are the foundation. Without them, even the correct vitamin combinations will not perform at their best. Think of these as the rules that make everything else work. Rule number 1. Always take fat-soluble vitamins, which include A, D, E, and K, with food that contains fat. Not a glass of water, not on an empty stomach. These vitamins require fat in the digestive tract to be absorbed at all. Taking them with a meal that includes some healthy fat, like avocado, olive oil, or eggs, can increase absorption by up to 32%, according to research from the American Journal of Clinical Nutrition. Rule number 2. Never take iron with coffee, tea, or calcium. The tannins in coffee and tea reduce iron absorption by up to 87%. If you drink coffee in the morning, which most of us do, take your iron in the afternoon, at least 2 hours before or after any caffeinated beverage. Rule number 3. Separate your B vitamins from your minerals. High doses of B6 and zinc compete for absorption in the small intestine. Many multivitamins contain both, but they are more effective taken at different times. B vitamins in the morning, minerals in the evening. Rule number 4. Always supplement magnesium if you supplement vitamin D. We covered this in detail earlier, but I want to reinforce it as a rule because it is that important. Magnesium deficiency from unbalanced vitamin D supplementation is one of the most common and most underdiagnosed problems I see in adults over 60. 200 milligrams of magnesium glycinate at night is a simple and safe starting point. Rule number 5. Review your supplement list with your doctor or pharmacist at least once a year, not because your health has changed, though it may have, because the research changes, because new drug supplement interactions are discovered continuously, because the supplement you started 3 years ago may now be understood differently. One annual review could prevent years of silent harm. Without these 5 rules, the safest vitamin combinations will still underperform. They are not optional, they are the operating system that everything else runs on. Let us do a rapid summary. The 5 dangerous combinations to never take together. Number 5. Calcium and iron together, blocking absorption. Number 4. High-dose vitamin E with blood thinners or vitamin K, creating dangerous clotting instability. Number 3. Vitamin D without magnesium, depleting the cofactor your body needs to activate the vitamin. Number 2. Vitamin K2 with anticoagulant medications, directly counteracting your treatment. Number 1. High-dose vitamin A combined with high-dose vitamin D, creating competitive hepatic saturation and silent liver and kidney stress. Each one alone is dangerous. Together, they create a perfect storm. Your liver has been working for you in complete silence for every one of those 60, 65, 70, 75 years. It has processed everything you have ever eaten, every medication, every supplement, every toxin, without asking you for anything in return. It does not send you warning letters. It does not alarm. It simply works quietly while you sleep, while you live your life, filtering and processing and protecting you from the inside out. What I am asking you to do today is return that quiet faithfulness. Not with a dramatic overhaul, not with fear, with information, with a small adjustment. Check what you are taking. Separate what should be separated. Test what should be tested. Give that organ the respect it has earned, because the decisions you make at your counter tomorrow morning, when you line up your supplements, will determine whether your liver has one more year of ease or one more year of silent struggle. You still have time to protect it. That is what matters. Before you go, I need to ask you to do 4 things that will take less than 2 minutes. First, subscribe to this channel. Every single week, I share medical information like this, explained clearly for adults over 60, information that can change the quality of your daily life and, in some cases, save it. Second, if anything in this video surprised you or made you think about something you are currently doing differently, click the like button right now. It helps this information reach the people who need it most. Third, leave me a comment with the words, "I am checking my labels today." That commitment, written down in public, is often the thing that makes it real, and your comment may be the one that prompts someone else, who is silently watching, to take the same step. Fourth, and most importantly, share this video with someone you love. A parent, a sibling, a friend, a spouse. Someone who takes supplements and has never thought about how they interact. You may not know today that you just protected them, but one day you might. This is Dr. Patricia Holt. You deserve accurate information, not fear, and not guesswork. I will see you in the next video.